An informative look into bipolar disorder by Elizabeth Blake. According to an article by Paula Martin and Teresa Odell, in the United States alone, bipolar disorder affects approximately 2.3 million people, and nearly 20% of this population will attempt suicide without effective treatment disorder interventions. So, in other words, 460,000 people are going to try and kill themselves because they don't get treatment. And that's scary because I grew up with a bipolar mother who went through those extreme lows and was contemplating suicide. So I wanted to do this speech to inform you, my audience, about what bipolar truly is, the 4 different types, and what treatments there are out there. So let's get down to it. What exactly is bipolar? Well, by definition, bipolar disorder is the extreme fluctuation between a high and a low, which is a manic and depression. And according to an article from the Cornell Illustrated Encyclopedia of Health, mania involves feeling of euphoria, and it's often accompanied by elevated mood, decreased need for sleep, and reckless behavior. From the same article, depression stages are characterized by feelings of hopelessness, sadness, and hopelessness, often accompanied by guilt, shame, and an extremely low sense of self-esteem. Bipolar disorder has also got a genetic component to it, where Tish Davidson states genetic studies on individuals with bipolar disorder have found abnormalities in the genes that control the production of myelin, which controls our impulses. So now that we have a little bit of an explanation, let's begin with the 4 types. First is bipolar 1, which is what my mother has. According to the article Bipolar Disorder in the Cornell Illustrated Encyclopedia of Health, the ups and downs of moods are extreme and feel out of control. These people are less likely to hold jobs down. They normally cut ties with their family and friends. They don't stay around for very long. And Judith Peacock states in her article Bipolar Disorder that this type almost always leads to hospitalization. Bipolar 2 has higher depression states, and in the article on bipolar disorder from the Cornell Illustrated Encyclopedia of Health, this mood disorder involves unstable moods varying from elevated to depressed, but the intensity of the manic phases is not as severe as in bipolar 1 disorder. Rapid cycling included, according to Judith Peacock and Bipolar Disorder article, is alternating episodes of mild depression and hypomania, which is a less severe stage of manic that lasts at least 2 years. These individuals are less likely to get help because it's such a short time and they're not so drastic changes. And finally, there's bipolar NOS, which doesn't, as Judith Peacock says, this refers to forms of illness that doesn't fit into the other 3 categories. These are normally have an underlying schizophrenia or split personality disorder, some other mental disorder underneath them. And though the life of someone with bipolar disorder is difficult, there are treatments. Lithium is a commonly used medication. Also, the article Antipsychotic Drugs states risperidone has been found useful. Marie Bassel states that for treatment of depression, bipolar episodes, mood stabilizers are preferred to antidepressants because antidepressants will make the patient more aggressive. Cornell Illustrated Encyclopedia of Health's article Bipolar Disorder states that the most effective treatment is a combination of medication and psychotherapy. However, many patients won't do either or fall off the wagon because of how the medication levels them out, making them face the monotony of life. They don't like that. An individual can control bipolar disorder with medication and therapy, but for now there is no cure. In closing, bipolar disorder is a mental disorder with manic or extreme high stages and depression or extreme low stages. There have also been genetic studies linking bipolar to what goes on in our brain. There are 4 types of bipolar disorder: bipolar 1, bipolar 2, rapid cycling, and finally bipolar NOS. And with the help of therapy and drugs, bipolar disorder can be controlled. Bipolar disorder has affected my mom and millions around the world. As a society, I feel we should inform ourselves and each other in order to help the millions still suffering, and hopefully find a cure so that the 460,000 attempted suicides will be none in the future. Thank you.